So you can take some questions.
Thank you, Doctor. Manuela, Paula, and Ken will be available for any individualized questions you may have as to why they're participating in this. So if you want to talk to them after, please feel free. Also, I just want to note that every quarter we hold a task force meeting. We bring people from across the region, not just all Erie County. There's people even from Niagara and other areas. And we invite the media. They're available to come. They're available to see the statistics. It is an open process, and a media advisory goes out. So if there are any opportunities to find out more about what's going on in the community, it's the task force meeting to do it. That is the opportunity, because you're going to get the latest and greatest information from our team. And I do want to thank our harm reduction team, because there's been some stories lately that make it seem like Erie County hasn't done anything, and that's absolutely incorrect. All you got to do is talk to the task force team, the harm reduction team, and you will know they're working their butts off trying to save people's lives. It's just not easy, because you're trying to save people's lives across the entire county, which is the same size as geographically as the state of Rhode Island. As you've heard me say before, we have a population that's greater than 5 states. You can't be in every home if somebody's using cocaine alone. So I just want to thank the harm reduction team for the work that they've done, because we see the statistics associated with deaths. You never get statistics associated with how many lives have been saved because of the work that they've done. And we will never know how many lives have been saved because of the work of the harm reduction team and others. But I guarantee you, if we're having 300 plus deaths a year, there's thousands of individuals in Erie County whose lives have been saved because of the work of the harm reduction team and the Department of Health. So I want to thank them for their work. With that, we'll open up to any questions.
Is there any concern with all these options available for drug use, that the normalizing of drug use is just adding to the problem?
People use drugs, Chris. That's the biggest issue. The old don't say no, the Nancy Reagan don't say no doesn't work. I don't know why people use them, but they do. And what surprises me is lately I've been getting the statistics associated with the age, the place of death, and the race. And then I'll see an obituary that matches up with that. I didn't have the name, I didn't have the individual, but I'll have the obituary, and I'll think, geez, I can't believe that person died of a fentanyl overdose. But they did, because they used a drug. It may have been the first time they used the drug. I think that's the thing you got to remember. It could be the first time someone uses cocaine. It could be the first time someone ordered what they thought was a different type of pill on the black market, and it turns out it was pure fentanyl. So I think what we just have to say is the Don't Say No campaign doesn't work. What we got to tell folks is, if you use drugs, there's a very high propensity that it's going to be fentanyl in it. And if you don't take it seriously, you may end up a statistic from our medical examiner's office. It's a similar message that we used a few years ago, but we were putting it in a much more narrow group of individuals when we were dealing with opioids, heroin. Now it's expanded because it's pretty much any damn drug that's out there. So I would love to be able to say, just say no, don't use drugs, and people automatically stop using drugs, but that's not the case. There's people going to be using drugs in the next hour in Erie County. There's people going to be using drugs at bars and parties tonight, and hopefully none of them die, but someone may.
Can I say something? Thanks. Thank you. So as the county executive mentioned, people are always going to use drugs. I mean, people have been using drugs forever. I mean, since, biblical times. So that hasn't changed. What's changed is, we're more aware of what's out on the streets, but just raising that awareness doesn't normalize it, doesn't mean make people are going to use more. It's just like, saying that teenagers are more likely to have sex because you have condoms around. I mean, it's not going to happen. What we're trying to do is harm reduction. So people are using, we're trying to give them options about how to use more safely so that they don't die. We want people to stay alive. So harm reduction is a key evidence-based strategy. That's why we have all the Narcan. That's why we're telling people not to use alone and use with a friend so they can get rescued. That's why we're telling people, even if they think that they're using cocaine or some other stimulant, to test their drugs for fentanyl, because they can be educated consumers, and then they'll know to have Narcan, to have a friend with them, and to not to use alone, and maybe just use a little test dose to see what happens. So harm reduction is a really important strategy, and that's why our outreach workers are out throughout the community and educating people about Narcan and the test strips, and making sure that everybody has access to them. So when they do use, because people are going to use, you can't put your head in the sand about it and hide. They are going to use. We're just going to help them use more safely so they stay alive until they're ready to think about getting into recovery or getting into a lifestyle or network where it's not as, it's easier for them not to use. So that's our strategy. Thanks.
How was the task force picked? Are these people that, former addicts that are counselors now or been through this before and things like that?
Yeah, the task force is pretty much everyone and anyone in this area. It's individuals associated not just with the health field per se, but their own experience, who are now mentors, peer coordinators, and counselors, as well as people from the what would be considered addiction services area, the mental health area, emergency room doctors, you name it, those who are seeing and dealing with this on a daily basis. So the task force is pretty varied, and law enforcement has a key role as well. I think what we realize is that there's no one area that has a monopoly on good ideas associated with how we best address this. So that's why you allow and open it up to others. I mean, last I knew, there were more than 100 people on the task force. They don't always attend every meeting, but then there's subcommittees associated with the task force that focus on particular areas, and they report back. Each subcommittee reports back to the overall task force at its quarterly meetings on the work that it's doing and the recommendations that it's coming up with. And as a result, it's one of the reasons why Erie County was considered a model for how to address the opiate crisis. Our task force and the way we went about it helped reduce the number of overdoses and overdose deaths for a number of years. And that changed as drug dealers started putting fentanyl in everything. Now we're no longer, as we said, talking about an issue just socially with opiates, but just drugs in general, any drug. And as I said in the question before, it'd be nice if we just say no and people stopped using drugs, but it's not the case.
Can I give it just a little bit of detail?
Sure.
Thanks.
Of course.
Sorry, I always have to get a word in. So, as
Doc,
a county,
did you hear her say that? She says she always has to get a word in.
you're not married to me. So, with our, as a county executive said, since our overdose epidemic has changed, our task force has also changed. So we've, first of all, we renamed it our Overdose Prevention Task Force, not just our Opioid Overdose Prevention Task Force. And then we've remodeled our work groups. So we have, different work groups that are working in their own, silos because of their own area of expertise. And it's the beauty of this task force. We all come together quarterly and share what we're doing, and that's how we get to think like, oh, I could work with them to do this, or I could work with this group to do something else I've been always wanting to do. So this is a great umbrella to facilitate collaboration. So we have our first responder group, so ambulance, EMS, EMTs, emergency department, fire, law enforcement, they're all there. We have our family support and advocacy and education group. And so, they're doing all those, and they will remind you that instead of using, the word addict, we use a person who used drugs. So just, person first, and then, describing them that they use drugs. So just, again, to reduce the stigma. We have our healthcare provider work group where I'm the co-chair with Dr. Jeff Lack, and we're looking at interventions to normalize harm reduction in primary care. and also to identify patients who are admitted to the hospital for whatever reason who have a substance use disorder and you know, help address their substance use disorder while they're in the hospital. So especially so they won't leave against medical advice, you know, only partially or untreated. We also have a substance use provider treatment group and a harm reduction group. So again, all these experts are working in their own field and doing projects and meeting regularly, and then we all come together quarterly, and I really encourage the media to attend. As the county executive said, you learn what each of the work groups are doing, how productive we are, how we're collaborating, and you'll learn the latest statistics of our overdoses and our both fatal and non-fatal, because now we get good data from law enforcement about the non-fatal overdoses that law enforcement responds to. So it's a really rich 2 hours, so I encourage everybody to attend. Thanks.
Any other on-topic questions? Sandra?
So out of the $1 million campaign, you said that it's a multimedia approach. Do you have a breakdown as to how you're allocating money? It sounds like social media is a big part of it, for instance. I don't know, like how much, you know, what percentage you're planning to devote to other forms of marketing and advertising. I don't know if it's possible to get that breakdown. I was also interested to know when money was first allocated in the budget for this $1 million campaign, and what is the excuse me, is the main message with this detect to protect, you emphasize harm reduction. Is this primarily like know what you're taking? Like come here to get, you know, because I see you've got the website up. Is it, you know, get fentanyl test strips? What, I just want to make sure I have a good understanding of the primary, when you say detect to protect, is that primarily just a know what your drugs are, we have free fentanyl test strips, and Narcan, is that the main message that you're trying to get out there?
Well, yeah, you just look at these different ads. Cocaine, 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 cocaine,
Right.
cocaine, cocaine. It's to focus on cocaine users, because that's what we've seen in the last year and a half is a dramatic increase in the number of overdose and overdose deaths of individuals using cocaine. It might not be the only substance they're using. They may be using other substances too, and often they are, but not always. We could have told in 2014 if someone died of an opiate overdose, they were probably dying directly from prescription drug overdose or heroin. There was nothing else. They may have had other drugs in their system, but that was the thing that did it. Now, it's people who don't think they're using opiates. So the focus is, you use cocaine, you got to detect it. People are still going to use it. There's been times in which we've come out here and announced, don't use your drugs, because we're seeing this massive spike of deaths in a 24-hour period. And as much as we say that, we know people are still going to use it because they got their drug there and they think, well, mine's probably fine. Well, there's no safe cocaine out in the system right now. We can give you the particulars associated with the breakdown of the marketing that we can do. I don't think we have it immediately right here, but we can give you that for your story.
Okay. And when was money budgeted for this campaign?
Well, it wasn't. I don't think you'll see it in the budget. It's part of the opioid settlement. Yeah. So this started last year, when we got confirmation. We did the RFP. We decided to split up the funding. We did the RFP for providers, and it takes time to get responses back and then award those contracts. So it's not as fast as we'd always like it, but that's sometimes how government works, because you just don't assign contracts and just put them out there willy-nilly. We did a process in which we sought responses back, proposals that is, to determine what would be in some ways the best bang for our buck. I wish it was a unlimited amount of money, but it's not. It's finite. And as much as $6 million is a lot of money, it can only be invested in so many ways. So I'm sure there's some folks out there who feel like, well, my agency wasn't chosen for the funding, and it had nothing to do with particulars associated with their agency as much as the proposals that we received and where we felt we could get the best bang for our investment, so to speak. Any other questions on topic?
Just impact marketing here based in Albany, and what the selection process was for the.
It's an RFP, right? Yeah.
So
Well, hang on.
Thank you. Thank you. So it was, we went through an RFP process, and we had an objective review panel review all the proposals. We had certain criteria that we used to score the proposals, And then we met and discussed, and then we ended up selecting Impact Marketing. They had the highest score, and it was pretty clear cut, especially after the top 3 scores. We asked them to make a presentation for us, virtually, so we can hear their story, and that Impact Marketing's presentation was really solid, and we felt very confident that they could meet our needs, and especially since we know that they have some really good experience working with the New York State Health Department. I actually called the AIDS Institute, Impact Marketing had worked with, and they just really sang their praises. They couldn't say good enough about them. So we were able to finally get the contract signed in January, and then we they left the gate running. They started doing the research, the plan that they had implemented. So they were busy doing the research. In the meantime, we knew we had to do something, so we put together some brief radio campaigns that we hope that many people have heard. I know that I've received feedback that people have heard our radio campaigns. I've heard the radio campaigns, and just to get the messaging out very quickly until they were able to complete their pretty in-depth research using looking at our data, doing research for evidence-based marketing strategies, doing focus groups, key informant interviews, working with our harm reduction team that is out in the community every day, looking at talking to people in our community, and then they have put together this campaign I think pretty quickly, and here we are today. So we're really satisfied with the work that Impact Marketing has done, and again, we continue to meet weekly. We check in, where we are, just in terms of the progress, and then we're going to start to soon, start to talk about the evaluation data, because again, we're continuing to evaluate it. Not only looking at our fatal and non-fatal overdoses and where they're occurring, we're able to look at, people are ordering fentanyl from our websites based on the campaign. We're looking at that, and test strips based on the campaign, and so we have other indicators that we're able to look at. So again, we're continuing assessing this, so it's not just a one and done, push the button and it's out. We have the opportunity to continually evaluate our campaign and keep it fresh, keep it new, and keep it relevant for people that we're trying to reach.
And just to show that all of us make a little mistake every now and then, you cannot order fentanyl from our website.
Right, sorry.
You can order fentanyl test strips and naloxone. I've made plenty of doozies, missteps during press conferences, and people said, I can't believe on topic questions. If not off topic, I think Rob, you had your hand up.
Yeah, kind of adjacent to this. With the Purdue Pharma ruling, does the county have a better idea of how any settlement funds that you guys would have received are going to be impacted by that process going forward? Or is that still really an unknown?
It's still an unknown. I mean, the one advantage is the funds we have are in our hands. So it's not like that we're going to lose those funds, because there were other parties that were part of the overall opiate settlement. I really can't answer what the impact is going to be with regards to the decision in the Purdue case. But we do have the cash in hand. We're going to get that. That was a settlement that was entered into by multiple parties. And I'm not worried about that, but the impact that has on any future dollars associated with the settlement in the Purdue case is a different one. Okay, please